scan in 2020 shows no residual lesion, but there in the operative bed, but there is thickening in the first part of the duodenum and the pylorus.
Did you guys get the history?
We can't hear you properly, Dr. Khalid.
Can you hear me now? आवाज आ रही है?
जी जी अब आ रही है जी.
अच्छा, तो you guys did not hear the history, I guess.
No, we heard the history.
Oh, you heard the history,
Yeah.
okay. So main goal is we are trying to take a look at the pylorus and duodenal bulb. There's some wall thickening there with the prior history of gist resection from that side. She doesn't have many major symptoms except a little bit epigastric discomfort. Ideally, we should take a look at that area with the EGD scope first, which was done last in 2017. But we're going to go ahead and take a look at the walls with the EUS, and we'll use endoscopic view as well to take a look at those. So, think, yeah, this is a good position right there. You are right at the aorta, perfect. And इसको जो है ना सही तरह बंद कर लिया करो. लगता है जो है ना तुम्हारा साइज छोटा करना पड़ेगा. चलो ठीक है, अब पीछे से बात किया. ओके, so this is the aorta that you can see he has put that in a perfect position. You see that celiac there. Celiac is right underneath the transducer, excellent. And now rotate a little bit to the left. You see that? How it's, you can follow that. Okay. So here, this is a splenic air towards splenic. Keep going, follow that and bring it. Perfect, okay. So there's a lot of air artifact. What you can do is, you got to the pancreas very nicely, no question about that. But there's a lot of artifact here, and because of that, you're not able to see anything there. So you put a little bit water, in the balloon. Yes, that's it. That's good. And now deflate that. There are a lot of air bubbles on the wall. That's what's happening. Okay. You see a lot of air bubbles in the stomach. That's fine. Okay. Let's go to the right side a little bit. This is better, much better. Okay. So here you see all the pancreas there. You see the splenic vein right there. Follow that towards the confluence. Right there. Okay. You see that the SMV came from the bottom and connected with splenic and then makes a portal vein which is going towards the liver. Okay, perfect. But let's now focus on the pancreas itself. Big wheel towards you a little bit. So you're right onto the pancreatic body right here. So
clockwise and a bit withdrawal.
depending on how the pancreas behaves. So yes, clockwise. That side, so you have to pull the scope back a little bit. Perfect. Right there, you see the pancreas where it ends right there. Splenic vein is here, artery is there. This kind of both are. This is artery area. It's just because of the position you are getting that from two areas. Okay. So here, keep going to the right. You see the left kidney. Perfect. We still see the pancreas, and you can see that it's kind of tucked. This is a very beautiful image right here. You did it perfectly well. So we're gonna right there. I'll freeze when it comes again. Pull it back a little bit. Okay, this is good right there. So here, a little bit more. Okay, that's right there. Okay. So here, if you look at this was a left kidney. This is a spleen right here. You can see this is a pancreas which is dipping down into the space between the tail is dipping down between the kidney and spleen itself. So this is a perfect way to take a look at the tail of the pancreas right here. This is a splenic hilum right there. Splenic vessels. This is a kidney, pancreas itself, pancreatic tail. So I'm going to unfreeze, and then we are going to do the opposite what we did earlier, which was the clockwise torque and pulling the scope back a little bit. Okay, so let's go towards the proximal body. Push the scope in a little bit, gentle. Good, perfect. So your goal is to keep the splenic vein and splenic artery right on the right up there. Okay, so okay, gently advance it right there. Okay, so that's a splenic vein right there. Keep going. Okay. Now, you don't let the pancreas run away from you. Okay, okay. So the splenic vein right there. Okay, keep rotating to the left. Yeah, so good. Keep rotating anti-clockwise. So this is kind of dipping down here, the pancreas into the neck area. Okay. Right, that looks pretty good. Big way towards you a little bit, right there. Okay. Now pull the scope back a little bit. Show me the portal confluence again. Good. Good job. Excellent. Okay, right there. Okay. And going into the neck area, no problems. Looks pretty good. Okay, let's go to the duodenal bulb now. And before we go there, we're gonna take a endoscopic look first. Good. Deflate your balloon, please. Okay. All the way. Okay, good. Inflate now the lumen. Good. Okay. Keep. Okay. Good. So because we needed to take and let's go into the duodenal bulb and make sure that looks okay too. I think taking a look with the endoscope first and then doing a radial might have given us a better view, 360 view of the pylorus as well as duodenal bulb. Okay, so same thing what happened yesterday. Okay, you have to come back. And your transducer is pointing downwards, so you did the right thing by pulling it back. Always do that. If you're not going in, it looks pretty good. So I don't see any really problem there. So this, not too much, okay?
Yeah, this is the point.
Yeah, and this is the point, but you didn't, and I need a little better view of that endoscopic, okay? Clean your lens, perfect. Clean your lens. Okay, now take your transducer in the left, right here, you see that? This area, right there, take your transducer, perfect. Okay, right there, big wheel towards you, little bit rotation to the right, okay. And what I'm gonna do is I'm gonna go to the main EUS image right now, okay. Look at that. So you're at the portal vein, okay. So that's where the portal vein starts. So you're a little bit, that is to the right of the screen. In this area, so we can have a better look at the whole pancreas, okay. What will you do that? Big wheel towards you, and while maintaining that, and pull the scope back a little bit. You see there's how much space there is, air, and that's why you are seeing all that air in this area, that's why, okay. Now you're slipping a little bit down, so pull back, scope, okay, that's better. Pull back a little bit more. Maybe you may have to pull back further. Okay, right there is better. Okay. So you see the PD there, and I think there's a bile duct up there as well. We just need to big wheel towards you. Okay. Pull the scope back further, further. Okay. Now, you see the bile duct right there? Okay, good. So we need to follow that. Yeah, नसर तो आ रही है लेकिन कोई it's not making what is all this, so we need to get into a better position to take a look at all that. So yeah, it's disappearing on this side. When that's happening, you have to pull the scope back a little bit, okay? Yeah, sometimes what happens, you have to bring it back to the pyloric area to really take a look at those. Okay? So it's not always from the duodenal apex. That's what I'm trying to say. Even though you start with that, but this is a little better view now. Okay. You see the PD right here. Your portal vein is right there. Okay. So we're gonna just gently, big way towards you, please. All the way.
Yeah.
There's a lot more. Okay. Okay. Now a little better view. You see that? Okay. थोड़ा सा rotate करो. The PD is right here. What I'm doing is I'm also taking a look at the duodenal wall right there because that's where the gist was. So I'm looking at that as well, and I don't see any thickness there.
Dr. Khalid,
that
can you
area.
tell us about the vascular structure? So which one is SMV and which one is
So
splenic?
here we need a better view. So this is a splenic vein right here, which is coming from this side, and it's connecting with the SMV where in the duodenal bulb. And there's a portal vein which is going up here. We're just are not in the best position right now to show that. But he's doing pretty good overall, at least bringing some structure. So let me see. Okay. So in this case, I think what's happening is like maybe a view is a little better close to the pylorus, but I'm gonna see if I can get a better view from the duodenal apex area. And even though I see the pancreas right there, so here a little bit, maybe a little better, right there. You see that portal vein is right here, splenic is here, SMV is here. You see a pancreatic duct right in that area. It's in the neck area right now. I'm going towards the, trying to go towards the ampulla, and you see the bile duct is right here on the top.
Yes.
Right there, pancreatic duct right there. So in her case, looks like the best view of the pancreatic duct and the bile duct together are ampulla is close to the pylorus than instead of duodenal apex, which is the, and that may be because of the surgery she had. She had a resection of that area before because of the gist. So that may be the reason. But we don't see any abnormality here. You see the bile duct right there. You see a pancreatic duct right there. And you see a portal vein right there, portal confluence. And if I follow this duct towards the neck of the pancreas by rotating anti-clockwise, you can see it's nice looking all pancreas right here, and the duct is dipping into the neck area. While I'm doing that, I have one portion of my eye on those walls as well. This is the first thing I looked at when we went in there, because that was the purpose of the examination, to take a look at the wall in the duodenal bulb and pylorus. And those looks pretty good. So what we can do is I'm going to pay more attention to these, and I'm going to rotate my transducer a little bit to take a look around that, because it's a obviously linear scope. So I'm rotating that, and it's making a circle around that. You see that? Making, and then I'm going to go to the other side, so I can take a really good look at the whole wall, making sure it's a little bit, looks like maybe a little bit thickness here, but I don't see, I can easily compress that. I see a nice muscularis propria still, but otherwise, like right there, a little bit loss of those distinct wall layers, but muscularis propria is absolutely intact. So these were possibly are the post-operative changes. Yep. Post-surgical changes. Otherwise, I'm going around that wall, looks pretty good. I don't think there is anything there. So same thing is at the pylorus too. We can take a look at the pylorus right here. I don't see any thickness there, really. Good. So that, and the purpose was to take a look at that with the EUS, and that's what we don't see. So let's go to the D2 now. Okay. Now, what I'll do is I'll let you do that, and then I'll explain. Okay, I'm going to come back because it goes straight to the landmarks. Okay. keep going. Good. Deflate कर लो balloon को. Perfect. Now you're in the right position, okay? When it's a short position, now you're going to step back, suction the lumen. Just suction the lumen, please. Suction further, 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 further. Okay. Now let's pay attention to the EUS image. You want to put a little bit fluid in the balloon? A little bit. That's it. No, not too much. You see that when you do too much, then it more air is coming. So just a little bit in there, okay? So now let's find our landmarks, which are aorta or IVC or pancreas, one of those, so we can follow the rest, okay? So you went quite deep in there, and she also had a surgery, so it's not going to be that deep. So you see the aorta, perfect, okay? Yeah. Yeah, withdrawal further, good. So you see the IVC right on top of that. So IVC is right here, rotate further to the right and pull the scope back, big wheel towards you. Good. You can step back, always take a step back. Okay, good. I don't know. We gotta make it look better, a little better. Okay, a little bit. This is a pancreatic right here, but needs to be pulled back a little bit further. Okay. Because this makes no sense. There's that much air, so I'm not gonna see anything. Okay. Aorta, you went back in there. Okay. IVC right there. Let's rotate from the aorta, rotate to the right. Looks like it's coming up here. We have to be able to maintain that. Good, good. That's the uncinate process looks like. Right there. This is all pancreatic tissue. Okay. Keep pulling back. I think the ducts are going to come up here. I can get a sense right there. They are there. अब scope को pull नहीं कर रहे तो if unless you pull, this is not going to come underneath the transducer. Okay, ठीक है, that's better. Okay. Came back a little too much. Okay, let me take a look. I think it's just all also because of the surgical anatomy. So you see the aorta was right there. Okay. Now there is no air. What happened? Okay. Did you see any air?
No.
Okay. What was happening?
Air की वजह से वो नीचे घूम
Why was there air? Because one thing is you're not approximating.
Okay.
Also, second thing, by mistake, you keep putting your finger on the button.
Okay.
Okay. So that's you need to switch from EGD to EUS. So this does not, finger should not go on the air button. So that's what was happening. Okay. So here you see that there is no air now whatsoever. Okay. And here, if you'll pay attention right now, you see the aorta right there, right? And looks like some those ducts are coming up on that area, right? Right there.
Yes.
Okay. And I'm not touching the air button. That's it. Right there is the pancreatic duct. Okay. And again, because of surgical anatomy, it may be a little bit challenging, but this is very important because you keep your putting your finger on the air button. Okay.
कल भी इसका मतलब
So
Ring.
two thing is like you're not approximating with that the wall, the transducer is not touching it, and the second is like you keep putting the your finger on the ear button. So yeah, it's also a little bit shorter that place because of the surgery, but there's nothing in the uncinate process or in the head area. So nothing there endoscopically, all looks good. So every time I use the EUS, I just make a habit, train your brain that you're not supposed to be putting your finger on the ear button. Okay, so are you up? Let's do the mediastinum area.
D2 दोबारा से कराएं?
No, that's fine. Move on. Okay. So next time you will remember now. Okay. Keep pulling the scope back. Keep pulling. Always in neutral position. Keep pulling back. Keep pulling back. Good. Good. Excellent. Keep coming back. So this left atrium. Okay. उसको जरा pull करो. And yeah, perfect. Okay. Okay.
This is subcarriage.
Yeah, still you're having some because yeah, big wheel towards you. You're not moving. Other thing is like not moving the big wheel towards you is not gonna put the transducer on the wall. Okay, that's one thing. That's how the ear is coming. Second is keeping a finger on the ear button. Okay, so now you can do this. You see that? Rotate there, and that's a subcriner right there. Okay, keep coming back further. Perfect. Good job. Excellent. Keep coming back, keep coming back, keep coming back. Okay? Keep coming back. Big wheel a little bit towards you. A little bit towards you. Rotate, push the scope in a little bit, like a centimeter or so, and rotate to the right. Beautiful. Good job. Okay. And you see a lymph node there,
Yes.
actually. Okay? That's fine. Good.
Thank you, sir.
Yeah,
Thank
good.
you so much.
Good. Welcome.
Finished.
G finished.
Thank you, sir.
चलो ठीक है